Hi there, I'm Dr. Tan and welcome to my vlog. If you haven't seen my previous two videos, I answered some questions that I got from TikTok. The first video I made was about all the TikTok questions that relate to general vision and eye health. The second video that I made was about all the TikTok questions that are about vision and eye health exclusively for children. So, today, I will be answering TikTok questions and I will only be answering them with a yes or a no. Maybe I'll give some few explanations. Let's see. Are you ready to listen to all my answers? It's very effective. It's actually the #1 myopia control treatment. It's the gold standard. Yes, okay. So there's different vision therapy strategies. Commonly, naririnig lang natin si vision therapy for strabismus, for lazy eye, but there's also a therapy for myopia. Okay, so what do we do? What kind of therapies are involved when we're dealing with myopia progression? We can do accommodative exercises using plus and minus lenses, okay? Para mag-lessen yung accommodation ng patient or para ma-exercise yung accommodation. Depends on the case of myopia ng patient. Repeated low red light therapy. Studies have shown that when a child or when a person or when a patient is exposed to there's a specific wavelength, okay, and there's a specific device that we use, pero basically, it emits red light, okay? And that red light slows down the myopia progression and can even stimulate the retinal cells and the eyeball to shorten. Okay, so why is it important to shorten the eyeball in patients who have myopia? The normal length of the eyeball is 24 millimeters. In patients who have degenerative or progressive myopia, yung mabilis yung pagtaas ng myopia and can cause diseases, yung ganung klase ng aggressive myopia, commonly, their eyeballs are longer than 24 millimeters. Sometimes it's 24.5, 25, 26, 27, and that's not a good thing. Because the longer the eyeball, the higher the risk for retinal detachments, macular degeneration, glaucoma, and all these diseases that are myopia related. So what we do is we expose this patient to repeated low red light para mag-stimulate ng retinal cells na mag-shorten at bumalik siya sa normal, slowly normal length. Okay? So, we start the treatment with an eggshell measurement and we monitor the eggshell measurement hanggang sa makuha natin yung goal natin or desired natin na eggshell length. And it has proven to be very effective. So, is therapy used for myopia patients? Yes, of course. It depends on your definition of permanent. Kasi sa Ortho-K, what we're trying to do here is we're measuring the parameters of your cornea so that we can design a mold, an Ortho-K mold that you can specifically wear for your eye, and that mold will be reshaping or changing the shape of your cornea, okay, through the process. Now, if you keep on wearing it every night, then of course, your myopia will stay corrected. Let's try to compare it with LASIK, no? So, si LASIK naman, it's a one-time procedure. Mas matagal yung effects niya. It can last for years, okay? But there are a lot of cases na after a few years or after how many years, bumabalik yung myopia slowly, no, ng mga patients na nagpa-LASIK. And what's challenging with LASIK is it's hard to do it the second time around because you can't keep on doing LASIK on one cornea, okay? Because of the post-LASIK complications that it can cause. So, there's that, okay? So, for me, Ortho-K is a permanent myopia solution as long as you keep on using the molds every night. Yes, kasi meron tayong myopia na yung true myopia. Okay, so sa true myopia, yung accommodation mo is fully relaxed. Okay, and because your accommodation is fully relaxed, it's hard for you to see clearly sa malayo. So, yun yung titawag nating RLRL, Repeated Low Red Light Therapy. Okay, yan yung vision therapy natin. Meron din tayong myopia na tinatawag naming pseudomyopia. Okay? It's caused by an overaction of the ciliary muscles that are in charge of focusing, near focusing. So, because there's overaction of these ciliary muscles, nagkakaroon ka ng nearsightedness. And what we can do naman for this management is we can use lenses and prisms to slow down, no? Or to weaken the accommodation somehow, or to educate the eye not to accommodate so much. Okay? So, yun yung ano natin, sinestabilize natin yung kanilang accommodation. So, myopia is a good, parang vision therapy is a good management for myopia, adjunct management. Of course, we need glasses for myopia, or contact lenses, or orthokeratology. And then, adjunct management natin is vision therapy, and our vision therapy will depend on what type of myopia the person has. Yes, anything has side effects. Ortho-K has side effects. Contact lens has side effects. LASIK has side effects. Everything has side effects. So, ano ba yung side effects ng Ortho-K? Of course, sa first mo nang gamit ng Ortho-K, lalo na if you've never worn contact lenses all your life, you're gonna feel some foreign body sensation, no? Na nandyan siya. And then, yung normal response ng ating mata kapag merong foreign body sensation is to produce so much tears because it will try to wash away the foreign body sensation and your eyes will become red. But in my experience, I think I have like 8 to 9 out of 10 patients who have successfully worn Ortho-K even in their first night. It all boils down talaga on proper patient education, proper use, proper cleaning of the lenses. Okay? And also yung perfect yung fit natin. Very important talaga yung fit para comfortable siya suotin. Yes, as I mentioned, yung myopia treatments natin, pwede tayong mag-glasses. When it comes to glasses, we have yung standard myopia correction glasses. We also have myopia control glasses na meron siyang correction zone and meron siyang treatment zone para ma-slow down yung progression ng myopia. We also have the same design applied for myopia control contact lenses where we have a vision correction zone and a treatment zone, myopia treatment zone to also slow down the myopia progression. So, merong glasses, merong contact lenses, and then lastly, we have orthokeratology where we alter the shape of the cornea so that we can correct the myopia at the same time stop it or slow it down. Okay, yung increase niya. So, yung adjunct managements natin will be therapy. So, it depends also kung ano yung kind of therapy na kailangan sa myopia. So, if yung myopia mo is pure myopia, ibig sabihin, walang accommodative spasm that's involved, we'll be purely using low red light therapy, okay? Repeated low red light therapy. Na expose natin siya sa red light, there's a specific machine that emits red light. You're going to use that para sa bata or sa adult para lower yung kanilang axial length, okay? Or ma-shorten yung kanilang axial length. Pwede rin tayong mag-use ng prisms and then plus lenses para ma-control natin yung ciliary spasms if there are ciliary spasms or over-convergence that's involved with the myopia. Yes, Ortho-K requires maintenance kasi nga, as I said, you have to use the Ortho-K molds every night para hindi bumalik sa dati yung grade mo. So, there's a lot of varieties naman, no, for the employment or the use of orthokeratology. So, it depends on your doctor and it depends on the patient, no, kung ano yung case niya. In my personal experience, I usually have a 1-month treatment phase. So, sa 1-month treatment phase, I ask the patient to wear the Ortho-K molds every night because that's the period that I am slowly altering the shape of the patient's cornea. After 30 days, natapos na namin yung treatment zone or yung treatment phase. So, completely altered na yung shape ng cornea ng patient. So, after that treatment phase, we call it the maintenance phase. Sa maintenance phase, I am just asking the patient to wear the Ortho-K molds para hindi siya bumalik sa dati niyang shape at magbalik yung kanyang myopia. Okay? So, what if a patient misses a night, no? Hindi niya na-wear yung kanyang Ortho-K molds during the maintenance phase, hindi niya nasuot yung Ortho-K niya ng isang gabi or ilang gabi. Magbo-blur ba kaagad yung kanyang paningin? No. Because we have already altered the shape of the patient's cornea. So, it will take some time, no? Ilang nights pa or weeks pa or days pa bago niya ma-feel na bumalik na yung kanyang dating grado. Okay? So, in my experience, meron akong patients na yung shortest siguro, meron akong patient na 3 days lang. Sabi niya, Doc, after 3 days, nag-stop ako mag-Ortho-K, nakakalimutan ko kasi nagbakasyon ako, I left it. Okay pa siya nung first day, second day, okay pa, I can still see, pero on the third day, I can sense na the blurring of vision. So, I tell my patient, okay, so do not go for more than 3 days that you're not wearing your Ortho-K molds para ma-maintain mo yung vision mo. Meron din naman akong isang patient, ang tagal, actually hindi lang isa, dalawa na patient ko, 2 weeks. They're not wearing their Ortho-K molds for 2 weeks. Hindi nila nasisense yung blurring of vision. Parang after the 2 weeks, tsaka pa nagbablur. So, they only need to wear their Ortho-K molds twice a month. So, it really depends. You must be monitored by your doctor. Yung use mo ng Ortho-K mo at yung pag-maintain ng Ortho-K mo must be monitored by your doctor. Yes, vision therapy can improve strabismus, lazy eye. Okay, yung strabismus, yung eye misalignment, either esotropia or exotropia. And then, lazy eye or amblyopia, yung hindi pantay yung vision ng right at ng left. Okay, mas blurry yung isang mata than the other, even with the best lenses in place. We can also use it for poor visual perceptual skills. So, ano yung sinasabi nating poor visual perceptual skills? So, when we talk about vision, we're not only talking about clarity. We're not only talking about the alignment of the eyes. There's a whole lot of things like visual memory. Okay, visual memory is when you look at something, it registers on your brain and in your visual cortex and in your memory area, and it registers there. There are times na walang visual memory yung bata or yung pasyente. Kahit nakita na niya, hindi niya matandaan kasi hindi napunta sa memory area niya at hindi maayos yung recognition sa brain. Another thing is yung tinatawag namin na figure ground. Figure ground is the ability of a person to be able to spot an object or a target in a very busy space. So, say for example, pag binakitaan mo siya ng crayon, okay, or scissors, ilalagay mo yung scissors sa table. Oh, look at this. This is a scissor. Alam niya scissor. Pero, nung nakalagay na yung scissor sa loob ng bag, pinahanap mo sa kanya, oh, asan na yung scissor? Get your scissor. Pagbukas niya ng bag, Mommy, I don't see a scissor. Okay, kasi there's a lot of other things there at hindi niya ma-determine yung mga objects individually. Okay, so very poor ang kanyang visual ground, visual discrimination. So, there's a whole lot of visual skills that vision therapy can help your child with. So, usually I advise vision therapy kapag medyo may difficulty yung bata sa school. And then, napatutor mo na, parang kawawa na yung bata kasi parang pinapunish mo na borderline punishment na sa kanya yung tutorials and all. Parang ilang hours, araw-araw, parang whole day na siya sa school, tapos meron pa siyang tutorials, tapos everyday. Tapos hindi pa rin siya nag-i-improve, tapos nakikita mo naman sa bata, tinatry niya. There's a chance na there's a vision problem involved in there. And when we say vision problem, I'm not just saying blurring of vision. I'm not just saying eye misalignment, but I'm also talking about the visual perceptual skills that I mentioned, and there's a whole lot more of visual perceptual skills problem. So maybe on my next videos, I'm gonna cover them. Yes, of course. Ortho-K is very much suitable for children, and we advise parents not to be scared of Ortho-K. Lalo na if you have a very good doctor who's very experienced when it comes to providing Ortho-K for kids. Like, say for example, yun nga sa experience ko, yung youngest patient ko is 3 years old. And he's doing well. His eyes are healthy with Ortho-K. So, wala kaming problem. At saka yun lang, kailangan lang talaga ng monitoring. So, mas maganda kasi mag-Ortho-K, the earlier the better. Bakit? Kasi, pag meron ng myopia, yung anak mo, lalo na sa mga bata, ang bilis mag-progress ng myopia nila. Ang bilis tumaas ng grado. So, the earlier they start to have their orthokeratology, the earlier it is slowed down. Okay? So, example, yung sa isa kong pasyente, he started with 500. And then, I've already discussed management options like eyeglasses, myopia control eyeglasses, yung mga may treatment zones na glasses. Meron na rin akong prescribe na myopia control contact lens, and then Ortho-K. But of course, some of the parents, they want to go the conservative route, and I'm just here to tell them their options. So, they first chose the myopia control glasses. After 6 months of monitoring, yung grade niya, even with the myopia control eyeglasses, became 900. It's so high. So, we really needed to address it. So, nag-Ortho-K kami sa kanya. Alam nyo yung 900 niya, ilang years na? 3 years na hindi tumaas. 4 years na hindi tumaas. And we're so happy. If only we did it from the start, nung nakita namin yung grade na 500, siguro 500 lang. Hindi na tumaas. Pero, we dilly-dallied for a while, for 6 months, and it shot to that grade. But, you know, still, we're still very happy that the child is able to see 20/20, very clear, walang problem sa mata, walang degenerative myopia diseases in the retina, and everything, the axial length is all normal. We're so happy. Na-correct namin with orthokeratology. Well, yun na nga, nothing is risk-free. Everything has risks. Surgery has risks. Contact lenses has risks. So, even if, you know, vision therapy is non-surgical, it can still have risk. Especially if there's, if parang you are not managed properly, or if you are not doing the therapy correctly. I'll just cite an example. I have a patient, nanggaling siya sa ibang doctor before coming to me, okay? She was diagnosed with lazy eye or amblyopia, and that's correct. She really had lazy eye and amblyopia on one eye. And then, they used eye patching, purely eye patching, okay? They patched the good eye, the better eye, para mag-rest for 2 hours a day, and then yung lazy eye is mag-function in lieu of that eye that rested, okay? So, it went well naman, hindi naman nagkaroon ng strabismus yung patient. Yun nga lang, here's the problem. Nagkaroon ng overpatching. Ibig po sabihin, yung mata na supposedly okay ho sana, kaso na overpatch, hindi na monitor ng doctor at hindi rin siguro na advise yung parents on how it's very important to monitor patching and the possibility of overpatching and its risks. Yung isang na overpatch, nagkaroon na rin ng lazy eye. Okay? So, paano yun? Nagkaroon na siya ng alternate fixation. Ibig sabihin ng alternating fixation, if say for example, if yung right eye niya is nagfa-function, yung left eye niya is hindi nagfa-function. If nagfa-function yung kanyang left eye, yung kanyang right eye is hindi nagfa-function. We don't want that. We want both eyes to have simultaneous fixation. So when we say simultaneous fixation, they must function at the same time. Hindi pwedeng one at a time na nagfa-function to pero hindi sumasabay yung kabila. Tapos ito naman, hindi sumasabay. That's why it needs to be monitored yung patching. Tapos, that's why also vision therapy is very important. Bakit? Kasi sa vision therapy, we are not focusing on the poor eye only. We are helping both eyes to work together and function together ng sabay. Yes, it can correct high levels of myopia, pero it all depends on your doctor's experience and on the type of lens that the doctor is using. Also, it depends on your cornea, kung ano hanggang saan yung kaya nating i-alter sa cornea mo. So, there's a lot of factors, okay? Hindi lang sa high myopia, pati rin sa low myopia, any kind of myopia, there's a lot of factors involved with Ortho-K. But, one thing's for sure, Ortho-K for me is the better option than LASIK because it's much safer because it's non-surgical. Naku, sad to say, it's not covered by insurance. Hopefully, in the future, we can work on that, no? But right now, it's not covered by insurance. Wala. Kasi nga, we can do it for really young kids. Alam mo, I always say it, no? Pero it's worth repeating. My youngest patient is 3 years old. But here's the thing. You know how old my oldest patient is? She's 72 years old. Okay, she's that old. She's using Ortho-K and Ortho-K is really helping her a lot. So, why did I do Ortho-K for her? Bakit? Because initially, she came to me, she's been wearing soft contact lenses for a really long time. She has very high myopia. Okay, she's 72 years old, she has very high myopia. She's been using soft contact lenses for a really long time to correct that myopia. Now, she wanted to stop using these soft contact lenses because she had some hypoxia or lack of oxygen na side effect because of this prolonged use of soft contact lens. So ngayon, she came to me initially for glasses. So I prescribed her with glasses. Of course, she needs something to see far. But I also opened up to her the possibility of doing orthokeratology. And you know what? She loved the idea of orthokeratology. We gave it a try and it worked for her and we're so happy. Yes, it can be used for children and adults. Orthokeratology is good for children, good for adults, good for everyone. Yes, we use Ortho-K for astigmatism. I've used kasi there's different kinds of astigmatism. We have myopic astigmatism, compound myopic astigmatism. We have mixed astigmatism, which is merong farsightedness and nearsightedness at the same time. And lastly, we also have yung hyperopic astigmatism. I'm usually parang not practicing yung other types of astigmatism, yung mixed and hyperopic astigmatism. But lately, I think 2 years ago, 3 years ago, I started managing mixed astigmatism and they're all successful. So it gave me some confidence to try managing patients with hyperopic astigmatism and still they're very successful. So I don't really see why orthokeratology won't work for patients with astigmatism. I've tried it for all types of astigmatism. They've worked and I'm happy. My patients are happy. You can try it too. It depends on what we're trying to manage here. Okay? So, let me just make some kwento. I had this patient. He initially came to me. He had a refractive error. Okay, may grado yung mata niya. Meron din siyang misalignment of the eye. So, I employed some prisms, I employed eyeglasses, and I also employed therapy. So, yung glasses na binigay ko sa kanya also has myopia control and also has some prisms. So, there's a lot of combined treatments that we've used. 2 years, 3 years down the line, now he has no grade. So, he's no longer using glasses for grade. He's just using it for blue light protection. There's still some eye misalignment that's remaining. So, we've used some very, very minimal prism just to correct the alignment, improve vision. He's still doing therapy, but the alignment talaga is very, very minimal. Nasa 2 prism na lang or 2 degrees na lang. Yung grado is halos wala na. I'm not saying that, we can do it for everyone. It really depends on the case. And it really depends on how willing the mom or the dad is, to undergo all these managements. But always know that we're always here for the best of the parang child, no? parang prescribing managements para sa ikabubuti nila. Yung ano natin, syempre lahat naman nung, minsan isipin natin, magastos, diba? Magastos yung mga maraming treatments na ginagawa. But, you know, money can be earned, money can be replaced. Pero yung paningin ng anak natin, yung kanilang kinabukasan nakasalalay sa paningin nila, yun hindi natin mapapalitan. So, I really suggest that we invest in our kids. Yes, very high success rate. It depends on the doctor, it depends on the patient as well, compliance, management, everything. But for me, very high success rate, 95%. Yes, 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 yes. I'm hoping that, you know, maybe in the next videos, I'm going to invite the #1 sports vision therapist in the Philippines. And I think the best sports vision therapist and probably, you know, the first and only pinaka. I hope that I can invite him and we can make a video together regarding this. So how did sports vision start? I'm not really that sure about it, but this is what I know, okay? So vision therapy was initially employed or used for patients na merong eye misalignment, merong difficulty sa vision, difficulty sa visual perception, and all these things. Okay? Visual reaction time, visual memory, figure ground, all these things. We try to improve people who have problems in these areas. Okay? Pero, there came a time na it was no longer used for people who had problems. It was also used for people who wanted to enhance their vision even further, such as athletes, di ba? Athletes kasi, they need to have a very quick reaction time and they need to have a very, very wide visual field so that they can see clearly even in their peripheral areas. So, yan yung mga isa sa mga ini-enhance ng sports vision therapy. And there's so many more, like visual memory. Diba, if you're very keen on watching basketball, some of the basic things that they do is to raise their hands, to block the sight of the player, no? Because if you block the sight of the player, you can prevent them from, you know, doing the next move because they can't see where they're going. And vision therapy, one of the exercises that done for vision therapy is also helping visual memory so that they can still, you know, reimagine their visual field or reimagine the court even with their eyes closed. So they are not stopped by these basic tactics na tatakpan lang yung paningin nila, hindi na sila makakita. So ang dami-dami talagang use ng vision therapy, lalo na sa sports. So I'm hoping that I can invite the doctor who's very good on sports vision therapy para I can share with you all what it can do for you. So if you have kids or if you're an athlete and you want to improve your performance, you know that there's something here for you. Yes, Ortho-K is reversible. If ang patient, example, I always tell my patients, if for instance you want to stop using Ortho-K na, you just tell us right away, okay? So, why do we need to know? Of course, because we're going to slowly reverse the procedure, okay? We're going to monitor the changes in the shape of your cornea and in your grade, yung refractive error mo. Usually kasi, sa mga nagsa-stop ng mag-Ortho-K, example ho, yung grade mo was around 300, okay? 300 yung grade mo pre-Ortho-K, tapos nag-Ortho-K ka na. Tapos, later down the line, you decided, I want to stop Ortho-K, I want to go back to glasses, contact lens, or something else. Usually, sa experience ko, yung 300 na pre-Ortho-K, post-Ortho-K niya, yung isa kong patient, naging 100 na lang. So, hindi siya bumabalik talaga sa old grade mo. So, I need to be able to monitor that and I need to be able to give you clearance and to tell you ano na yung grade na nakukuha mo ngayon post-Ortho-K para hindi rin sayang yung pera mo if in case you're going to buy glasses or contact lenses because you can't use your pre-Ortho-K grade as a basis for your new glasses or your new contact lens. We need to use your post-Ortho-K grade, which is usually much lower. Sa case ko, sa experience ko, and sa practice ko, I do require frequent visits. So, commonly for vision therapy, I require my patients to see me every 2 to 3 times a week. Pero meron akong patients na medyo far-flung areas, like even if I'm here in Davao City, they're coming from Tagum, from Cotabato, from Kidapawan, from Digos, from all over Mindanao actually. So, meron din ako from Zamboanga, as far as Zamboanga. They can travel here once a week. So, pagka ganon, I give them home-based exercises that they do every day. And then, they come here once a week for clinic-based therapy. I cannot give purely home-based exercises kasi there are exercises that cannot really be done at home. So, at least man lang once a week, they should be here. So, usual frequency ng clinic-based ko is 2 to 3 times a week for patients na geographically malayo or parents who are in Davao City but really, really busy who can only come once a week. We do a clinic-based therapy once a week and we do a home-based therapy every day. So, there's a cost for the clinic-based and there's a separate cost for the home-based because sa home-based, we give them all the materials. It's for them to keep. Okay? So, their sessions are also not limited kasi sa clinic-based therapy, they pay per cycle. One cycle is equivalent to 20 sessions. Pero, that's the clinic-based. Sa home-based kasi, I give them the material so they're not limited to how much sessions they can do. They can just do it at home for a year even, di ba? Continuously because the materials are already theirs to keep. Some of my patients naman, even if they can come sa clinic 2 to 3 times a week for clinic-based therapies, they still want home-based therapies then to bring home para mas faster yung results. So, we still do both for them. It really depends. So, ang pinaka-important lang talaga is for me to be able to make a thorough assessment of your child's case so that I can discuss all the options for you and we can work together on what's best. I hope you learned a lot from all my answers today. I hope you also watch my other videos. And if you haven't followed me yet, please follow me on TikTok, Instagram, and follow my Facebook page, Dr. Larine Dontan, for more information about your eye and your vision. Take care of your eyes. Bye!